Short bowel syndrome, SBS, is a complex malabsorptive disorder that occurs when a significant portion of the small intestine is surgically removed or non-functional due to disease, leading to an inability to adequately absorb nutrients, fluids, and electrolytes. This condition most commonly results from extensive bowel resection due to Crohn's disease, mesenteric ischemia, volvulus, intestinal trauma, or congenital defects such as gastroschisis. The severity of SBS depends on the remaining length and function of the small intestine, the presence of the ileocecal valve, and whether the colon remains intact, as these factors influence nutrient absorption and adaptation. The small intestine consists of three main sections: the duodenum, jejunum, and ileum, each with specialized absorption functions. The jejunum is responsible for absorbing carbohydrates, proteins, fats, vitamins, and minerals, while the ileum absorbs bile salts and vitamin B12. The ileocecal valve, which separates the small and large intestines, slows intestinal transit time and prevents bacterial overgrowth. Patients who have lost a significant portion of the ileum and ileocecal valve are at greater risk for malabsorption, diarrhea, and fluid electrolyte imbalances because bile salts are not properly reabsorbed, leading to steatorrhea and fat-soluble vitamin deficiencies A, D, E, and K. If the colon is intact, it can help compensate by absorbing fluids and electrolytes, reducing diarrhea severity. Clinically, patients with short bowel syndrome experience severe diarrhea, dehydration, malnutrition, weight loss, electrolyte disturbances, and fat-soluble vitamin deficiencies. Hypocalcemia, hypomagnesemia, and iron deficiency anemia are common due to impaired mineral absorption. The malabsorption of carbohydrates and fats can lead to bloating, flatulence, and steatorrhea. Patients often develop bacterial overgrowth due to altered motility, further exacerbating malabsorption. If left untreated, severe SBS can lead to failure to thrive, osteoporosis, kidney stones due to oxalate absorption, and metabolic acidosis. The management of short bowel syndrome involves a multidisciplinary approach, including dietary modifications, pharmacologic therapy, and in severe cases, parenteral nutrition (PN) or small bowel transplantation. Initially, patients often require total parenteral nutrition (TPN) to maintain hydration and nutrition, particularly if they cannot absorb sufficient nutrients enterally. Over time, intestinal adaptation occurs, where the remaining bowel undergoes hypertrophy and functional compensation to increase nutrient absorption. To enhance this process, patients are encouraged to consume small, frequent meals with complex carbohydrates and avoid simple sugars that can worsen diarrhea. A high-protein, low-fat diet is typically recommended, along with supplements such as calcium, magnesium, vitamin B12, and fat-soluble vitamins. If the colon is intact, a diet higher in complex carbohydrates can be beneficial since the colon can ferment undigested carbohydrates into short-chain fatty acids, providing additional energy. Pharmacologic interventions include antidiarrheal agents such as loperamide or diphenoxylate atropine to slow transit time, proton pump inhibitors, PPIs, or H2 blockers to reduce gastric acid output, as gastric hypersecretion is common post-resection, and bile acid sequestrants such as cholestyramine to bind excess bile salts that contribute to diarrhea. Glucagon-like peptide-2, GLP-2 analogs such as tetraglutide have been developed to enhance mucosal growth and improve absorption, potentially reducing dependence on parenteral nutrition. In severe cases where intestinal failure persists, intestinal rehabilitation programs and small bowel transplantation may be considered. From a nursing perspective, patient education is critical in managing fluid electrolyte imbalances, optimizing nutrition, and preventing complications such as dehydration and metabolic disorders. Nurses should monitor intake and output, daily weights, electrolyte levels, and signs of dehydration, including hypotension, tachycardia, and poor skin turgor, encouraging oral rehydration solutions and providing education on dietary modifications can improve quality of life. For patients on parenteral nutrition, nurses must monitor for complications such as central line infections, thrombosis, and liver dysfunction. Emotional and psychological support is also essential, as living with short bowel syndrome can be highly challenging, requiring lifelong dietary adjustments and medical interventions. In summary, short bowel syndrome is a serious condition characterized by malabsorption, diarrhea, dehydration, and nutrient deficiencies due to extensive small bowel resection or dysfunction. The severity depends on the remaining bowel anatomy, and treatment focuses on nutritional support, pharmacologic therapy, and intestinal adaptation. Nurses play a vital role in patient education, symptom management, and monitoring for complications to enhance patient outcomes and quality of life. Understanding the pathophysiology, clinical manifestations, and treatment strategies of SBS is essential for a nursing student to excel in exams and clinical practice.